I am Dr.Matrika Johnson. I am a reproductive endocrinology and infertility specialist. I work at Reproductive Specialists of the Carolinas in Charlotte, North Carolina. In general, as far as looking to see a fertility specialist, if you are less than 35 years old, you should give it a full year. You should try to conceive for a year, and if after a year you haven't, conceived, then you should see a fertility specialist. If you're 35 or older, you should wait 6 months. And if you are 40 or older, that's a trickier situation. My recommendation is you should at least go in and get testing. But some people will say maybe you should at least give it 3 months. Other things are if you're, a female that has irregular menstrual cycles, then you should probably see someone immediately. If you're having irregular menstrual cycles, it probably means that you're not ovulating regularly. If you're not ovulating regularly, it's going to be really hard to get pregnant. Other reasons, uterine fibroids. You may want to go ahead and get that HSG or get a dye test to look at your uterus just to make sure that there's not a fibroid blocking your tube or there's not a fibroid in your cavity. Other reasons would be if your male partner knows that there's, he's had some type of testicular trauma, or if you've had, radiation or anything in the past, then that might be a reason why you might want to see, a fertility specialist sooner as opposed to waiting the designated amount of time. If you have endometriosis, seeing a fertility specialist, I think that that's a case-by-case scenario. Endometriosis can come in 4 different stages, all the way from stage 1 to stage 4. And I do think that if someone knows that they're trying to get pregnant with stage 3 or stage 4 endometriosis, I do think that they're probably going to need to start off seeing a fertility specialist. If someone knows that they have mild endometriosis, maybe stage 1 or stage 2, then I think that, trying on your own makes sense. And that kind of goes along with the treatment recommendations. For someone with stage 1 or 2 endometriosis, the first line treatment is IUI. With stage 3 or stage 4, the first line treatment is IVF. So as far as looking at recurrent pregnancy loss and infertility, they are not the same in any way, shape, or form. RPL is RPL, infertility is infertility. The definition of recurrent pregnancy loss is having 2 clinically recognized pregnancies that have been lost. And so if at any point, someone meets that definition, whether they ended up pregnant in June and then they ended up pregnant, again in August, but they lost them both, they should go see someone immediately.